Thank you for taking my question. First of all, you hit on a few key things that I believe strongly in. One of them is that the future truly does rest in my possession. I'm going to be the one who has to pay for all the deficit that we're getting right now. Why is it that capitalism can't take care of this problem now? Why can't we encourage? Why do we have to create a huge oligarchy regarding the insurance companies? Why can't we encourage capitalism and the current the systems, right? The true intention of our forefathers. Yes, like how
Let me just indicate, you're correct, but the fact is that right now there's a huge gap of people that are uninsured, and we cannot sustain. We cannot continue. You talk about taxpayers. We cannot continue to pay for what we have now because of the fact that we have to look at. But in terms of the cost of prescription drugs, and we chose not to do anything about that. We chose not to do anything about some of the abuse, and we need to move on that also. And you're right, we're handing you the debt. This war is one of the first ones that's not paid for.
How are you supposed to believe what?
Yeah, I'm not looking at your leadership, sir. You have always exhibited leadership. I said if President Obama had wanted the wounded soldiers from Iraq to pay for their own medical care with private insurance, how are we supposed to believe in him to begin with? He's going all around the country pushing for a health care plan that is supposed to be better, but yet is that how we would want to treat our wounded soldiers? And to speak to what I'm looking at is,
okay, let me share with you. I've had the opportunity to go into Iraq and Afghanistan, and I directly visited all the healthcare facilities that we have out there. And I'd have to attest to you that at the beginning we were not there. Now it's top notch. If that soldier is injured, and 99% of the time, if he's still breathing when he reaches there, he's going to live. And we're doing, our men and women down there are doing a tremendous job, and most of them come from San Antonio, right here at Fort Sam. And we're really proud of the hard work that they're doing. On the VA side, and let me just say, after they leave the military, on the VA side, we still have a long way to go, sir. As you well know, I am pleased that, for a long time, I was frustrated on the VA committee for 8 years. We saw co-payments, we saw additional fees for our veterans, we saw cuts here, we saw the so-called care committee that was looking at recommending cutting services and cutting clinics and hospitals. In the last 2 years, we've kicked in over $13 billion into the VA system. And so I feel good about that. Having said that, we're not even very close to where we need to be. We have too many soldiers coming back with post-traumatic stress disorders. We think there might be 250,000 of them when all is said and done. Not to mention that a lot of our soldiers are coming back with, and in all honesty, if it had been during Vietnam, they would not have been coming back. And so I feel real strongly in that area. I'm going to do whatever I can, as I indicated to you. In the area of TRICARE really concerns me, because TRICARE, this past budget called for some major cuts, not only on Medicare, but on TRICARE. And so we have to be cautious there. And in TRICARE, if you live in San Antonio, you're okay because you get taken. But if you live in West Texas, you have a problem because some people don't like the reimbursement rates from TRICARE. And these are soldiers that have served our country, and we need to do better for them.
I'd like for you to respond how you think our government, with the track record they have, considering Freddie Mac, Fannie Mae, Social Security, Medicare, our wonderful post office, how we can trust that they're going to manage this huge program they want to start. you know, you don't sense a lot of trust in this audience.
That's it. We hear your question.
Okay, thank you very much. Let me just say to you, there's no doubt that we have some problems. She mentioned, and I want to share with you because, but I want to give you a comparison. Right now, from a taxpayer's perspective, if you have Medicare, Medicaid, and you have Medicare Plus, to the taxpayer, Medicare Plus is costing us more, and in some cases double the amount. And that's run by the private companies. So, the other, and in defense, let me talk in defense of the post office. Some of you might laugh, but let me share with you. If you're in any other country, you cannot mail anything and feel secure. If you're in Mexico, you don't feel secure. The other reality is that the post office, as you well know, we all know that the private sector might do a good job in an urban area where there's a lot of people, but it was meant also to reach out to rural America so that they would get access. And we subsidize that. And we understand that. And that's important. Just like we also as Americans, we also feel very strongly that the farm-to-market roads were important for all of us, including the farm communities. We also understood that if we wanted to get out of the dark, we needed to also provide electricity in rural communities. And the private sector will never be there. But in all honesty, she's also right. We have a mess. And I can tell you, in the Department of Defense, let me just give you one data, because I agree with you in some of those areas. One data. We asked, I'm on appropriations, we asked the Government Accounting Office to give an assessment of the contracts just on the Department of Defense. They told us we cannot do that because we don't have the workers. And so we asked them, go back from 2004 to 2008 and look at just cost overruns. The response was over $300 billion of overruns. Defense. We got to put a stop to that. We cannot tolerate that. In the area of healthcare, we have a lot of abuse. And I can tell you that we got to do what we can. It might require a separate bill to look at that, but we cannot continue to do what we've been doing. Right? In spite of the problems that we might have, this is still the best country the world has ever seen.